The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everyone. Welcome to today's webinar, and thank you for joining us. My name is Deanna Helscher, and I am the Regional Dean at the UTHealth School of Public Health in Austin and the Director of the Michael and Susan Dell Center for Healthy Living. I'm also Principal Investigator of the STREETS project. So I'm very happy to have this presentation today, and it's especially appropriate this week because next week is National Bike to School Day on Wednesday, May 5th. So we'd like to make a plug for that at the beginning of the webinar. So before we get started, I just wanted to make sure that I went through some housekeeping items. So first of all, this webinar is being recorded and will be archived along with the presentation slides on our website at msdcenter.org. A direct link will be sent to all attendees later this afternoon, so you'll be able to access it at that time. If you have any questions during the presentation, be sure to enter them into the questions chat box. We will have time for a Q&A session at the end of the presentation. And so now I'm excited to introduce our speakers for this afternoon's talk. We're joined today by Dr. Leanne Ganzer, Sarah Bentley, and Amir Imamian. So Dr. Ganzer is a postdoctoral research fellow on the STREETS Study with the Michael and Susan Dell Center for Healthy Living. So she serves as the measurement coordinator for the project. She received her doctorate from UTHealth School of Public Health in Austin in Health Promotion and Behavioral Sciences in 2019. During her graduate program, she was one of our Dell Health Scholars, and she also worked as a research assistant on many projects. Prior to graduate school, she worked in nonprofits and a local health department in health education and active living promotion. Sarah Bentley is the project director for the STREETS Study. She joined the center as a graduate research assistant in 2015, and she provided faculty support for manuscripts and grants, as well as serving as project manager for our center school stakeholder interview project. In 2017, she was added as full-time staff on the Texas SNAP Ed Evaluating Impact Project, where she coordinated logic model development, advisory committee duties, evaluation, needs assessment, qualitative analysis, and reports. Amir Imamian completed his Bachelor of Science in Health Promotion and Fitness with a Spanish minor from the University of Texas at Austin. And he also completed a Master's in Public Administration from the University of Texas Pan American. He has 10 years of experience in the nonprofit world and has been with the City of Austin for 6 years. He is currently at the helm of the Safe Routes to School program, whose mission is to reduce barriers that prevent children from actively traveling to school by providing crossing guards at warranted locations, educating students on pedestrian and bicycle safety, and engaging with the community. So today's webinar, if we could go to the next slide, is hosted by the Michael and Susan Dell Center for Healthy Living, where our vision is healthy children in a healthy world. So you can't have healthy children without healthy communities, and Safe Routes to School is definitely a part of that. And the next slide gives an overview of the presentations today. So we will start out with Dr. Ganzer giving a talk on the importance of active commuting, followed by Amir Imamian on the City of Austin Safe Routes to School initiative, which is really unique and innovative in terms of allocating monies for Safe Routes to School infrastructure. And then finally, Sarah Bentley will conclude with an overview of the STREETS Study and a few slides with preliminary data. So with that, I'd like to hand it over to Dr. Ganzer.
Thanks, Dr. Helscher. We can go to the next slide. So I'll start off by giving some background information on active commuting to school in children, including why it's important. I'll discuss a little bit about the prevalence of active commuting to school, as well as some overarching strategies that communities can use to try to increase active commuting. First of all, there are many health benefits to active commuting to school for children and adolescents. Active commuting is an important source of physical activity, and this is of particular value for individuals who may be at risk for already low physical activity levels, including adolescents as well as females. The diagram here shows the increase in moderate to vigorous intensity physical activity at both the morning and the afternoon travel periods for children who walked compared to those who drove in a car. Active commuting to school is also related to cardiorespiratory fitness, although this is largely limited to cycling due to its greater exercise intensity compared to walking. Active commuting is also related to, and there have been promising findings with active commuting in cardiometabolic health, muscular fitness, as well as some psychosocial health indicators, although additional research is needed in these areas. Next slide, please. In addition to the public health benefits, there are several economic benefits from active commuting to school, including the decreased use of private automobiles for families, as well as other motorized transport, including busing to school, decreased congestion around schools, which leads to time savings, decreased traffic-related injuries and fatalities, and finally, decreased healthcare costs from the health benefits that I mentioned on the previous slide. Next slide. There are also environmental benefits of active commuting. First is the so-called small form factor. And because compared to automobiles, active transportation modes require very little physical space, especially walking, simply because there's no need for any additional power. Active transportation modes also consume less land than automobiles and therefore impose little burden on the environment, as shown in the figure on this slide. Additionally, active commuting to school is a form of clean transportation. Active transportation modes are generally cleaner than passenger vehicles. Compared to cars, walking and biking requires no gasoline or diesel fuel, and thus generating no carbon emissions or pollutants. And finally, active commuting to school creates fewer wastes and resources used. There's virtually no waste or disposal problems associated with walking. Similarly, the life cycle cost of producing, using, and disposing of one bicycle is far less than that of a passenger vehicle. They're made up of a smaller number of parts, less complicated components, and therefore more likely to be recycled and repurposed for other uses. Next slide. But despite these many benefits, over the past 50 years, the prevalence of active commuting to school has plummeted. These data from the US Department of Transportation's National Household Travel Survey show the decline in active commuting, which was 47.7% in 1969, compared to just 10.9% of kindergarten through 8th grade students in 2017. And as you can see, this decline tracks almost perfectly with the rise of the personal automobile for school travel. There are a few reasons posited for the decline in active commuting. First is the distance from school that students live has increased due to school preference and open transfer policies, as well as urban sprawl, school siting policies, and small school closures. Also, children's independent mobility has decreased over the past few decades, and fewer children are allowed to travel to and from school without adult supervision. And finally, parental concerns about safety from crime and road traffic have been cited as major deterrents of active transportation compared to 50 years ago. Next slide, please. And because of this decline in active commuting to school, it's important to understand what drives these travel behaviors and the choices behind these behaviors. This social ecological model shows the multiple levels of influence on children's active commuting to school behavior. At the center, there is individual level factors such as age, gender, ethnicity, and attitudes. And as we move outward through the model, there are interpersonal factors, community factors, built environment, and all the way out to the policy level. And as policymakers and practitioners consider developing and implementing interventions that promote active commuting to school, this framework is really important to keep in mind, as interventions that target rings further out on this model have the potential to influence more people and also be a more sustainable intervention. Next slide, please. And as we all know, around the US, school looks different than in previous years, and this may continue to look different into the fall. And there are several factors along these lines that make active commuting to school even more important to promote. First, school districts and states are considering several variations of in-school and at-home learning, which may lead to limited physical activity opportunities, such as recess, PE, after-school sports, which makes incorporating physical activity into other daily routines, such as commuting, especially important. Additionally, active commuting to school can be an opportunity to rebuild some community and social connections that may have been lost for children in recent months. Next slide. So Safe Routes to School initiatives are an important component of promoting active commuting to school. And these initiatives seek to make it easier for kids to walk and bike to school using a comprehensive approach with multiple components, including education, engineering, evaluation, encouragement, engagement, and equity. And transportation professionals, public health and planning professionals, schools, community groups, as well as families, all have roles to play in these different strategies. The rest of this webinar will focus on two of these components: engineering, which focuses on creating physical improvements to streets and neighborhoods that make walking and biking safer, more comfortable, and more convenient. So Amir will talk about the City of Austin's Safe Routes to School infrastructure changes. And also evaluation, which seeks to determine which approaches are more or less successful, which ensures that programs and initiatives are supporting equitable outcomes and identifying unintended consequences or opportunities to improve the effectiveness of each approach. And so Sarah will describe the STREETS Study, which evaluates the health effects of the City of Austin's infrastructure changes. And this partnership began in 2017 and has been an amazing opportunity for collaboration between our research center and the City of Austin. So with that, I will hand it over to Amir to talk about the City of Austin's Safe Routes to School program.
Thank you, Leanne. Next slide, please. Good afternoon. Name's Amir Mominigan, and I wanted to give you a brief overview on the City of Austin's Safe Routes to School program. Next slide, please. Our mission is to increase the number of students walking and biking to school by creating a safer, healthier, and more equitable environment that fosters human-powered transportation. And our vision is to engage with the community to create a safer, healthier, and more equitable environment that fosters human-powered transportation as the first choice for City of Austin students. Next slide. This is done through our 4 different programs. We have our Crossing Guard program, engagement, our education program, and most recently our infrastructure program, where we're actually building out infrastructure improvements. Next slide. One more, please. Our Crossing Guard program oversees services 7 different school districts with schools within the City of Austin. So those are Austin, Leander, Round Rock ISD, Del Valle, Eanes, Pflugerville, and Manor. And within that, we have 7 crossing guard supervisors that oversee 21 supervisor assistants. And we actually have 205 crossing guards overseeing 205 crossing locations throughout the City of Austin. Next slide. trainings and special events. We host a fall and spring training for all 205 crossing guards to make sure that they're most up to date with best practices, and it allows us to address any concerns or any issues we're hearing from the community. We also host multiple team building activities with our crossing guards. We host new employee orientations. We also provide partner trainings where we go out and work with schools that aren't within the city of Austin or other school districts or even other cities and provide them with information, help them train their guards so that they're also practicing best practices. We also host an annual Crossing Guards Rewards and Recognition program a celebration to reward our crossing guards for all the hard work they've done throughout the year. And within our crossing guard program, we also have the deferred disposition program. So for individuals that are speeding through a school zone and receive a citation, they're able to shadow a crossing guard for 2 shifts. The first shift is conducting a pedestrian count to see how many kids are actually crossing. And the second shift, they're making marks on the number of distracted drivers. And this just brings awareness to the importance of safety and following speed zones in the school zone area. Next slide. For our education program, slide. The services offered are elementary school education. Our education team actually goes out and takes over a PE class for 2 to 3 days and speaks to students in regards to how to be safe pedestrians and bicyclists over those 3 days. We also do daycare education, attend school fitness nights, attend community fairs. We also provide adult education. We do safety patrol training. We help host bike rodeos, assist with bike trains, assist with walking school buses, promote walk to school day, promote bike to school day, and also one of our big initiatives, which is Bow Wow, Bike on Wednesday, Walk on Wednesday. It's a way we see where we can get involvement from the school community at least once a week. So we push that on the schools to help promote. Next slide. The number of students, overall students trained, as you can see here, we average about 47 to 48,000 students a year that our education team actually interacts with and helps train. As the city of Austin's demographics change and students are kind of moving out, you can see sort of a downward trend, but we are still averaging about that 47 to 48,000. This last year, because of COVID, we had to stop going out to the schools in early March, so we were only able to train about 36,000 students. Next slide. Our engagement program, next slide, please. The goal of our engagement program is to create sustainable behavioral change that results in an increase of the number of students walking and biking to school. And our approach is involving the greater community, not just focusing on the school itself, but the community as a whole to get more people walking and biking. If kids see that behavior, then they mimic that behavior. Looking to activate new infrastructure as new bike lanes, sidewalks, and crossing improvements go in, actually going into the school, talking to the parents, talking to the students, talking to the school about these improvements so that it's actually being utilized. Coordinating with other city programs and departments, so partnering up with the Parks and Recs department if they're hosting events, or with our the Austin Transportation Department as barriers are being addressed. Creating a recognition program as schools become more involved with us and participate in more and more events with us, providing them with some type of recognition, providing them with prizes, things like that to keep that motivation going. Being more parent-focused and health-focused. So not necessarily just, the safety of walking and biking, but also talking about the health benefits. If a kid walks for 10 minutes in the morning, they're better suited for the day to get to learning. They've gotten, as we say, the wiggles out, they're ready to learn. So pushing more of that messaging to parents and even to school personnel so that they help promote the walking and biking aspect. And then being more data-driven, looking at the counts for the number of students that are walking and biking currently to a school, and then doing an analysis to see how many kids actually live within a half mile. So if 90 kids are walking and only 100 live within that catchment area, that's great. But at other schools, we have 20 kids that are walking and 100 kids that live within a half mile. So let's get engaged with that school and try to promote our initiatives and get more of those kids walking and biking. Next slide, please. Our infrastructure program, which is our newest. Next slide. In 2016, the city of Austin passed a $720 million mobility bond. Of that, $137 million was allocated to local mobility, and Safe Route to School received $27.5 million to be evenly distributed among the 10 council districts. This is the first time Safe Route to School had ever received any type of funding. Previously, we'd always have to rely on our partners, either in the sidewalks division or in transportation, to address concerns that we were hearing from campuses. So our approach was two-pronged. The first thing we did was we made an initial ask of all our schools. What are your biggest concerns? And the reason for that was to address those low-hanging fruit, to address those small barriers that we kind of knock out very quickly. The second thing we did was we brought in a consultant team, tool design group, to conduct walk audits at all the elementary and middle schools within the city of Austin. So they conducted walk audits, hosted community meetings, created a wiki map for people to be able to put input in. We did an internal review with all the data they had provided. Then we released the drafts of the infrastructure reports, again, to the public to make sure that nothing was missed, that we hadn't somehow overseen anything. We had a 3-week comment period and then came up with our final infrastructure report. Next slide, please. So in total, 137 walk audits were conducted at local elementary and middle schools. As you can see, there's a wide range of numbers per council district. So Council District 1 has 18, Council District 9 has only 8. So these are spread throughout the whole city. Next slide. And each district had a different number of barriers that were identified. In total, there were 4,654 barriers that were identified. As you can see, again, there's a wide range from 609 to 334. Next slide. And this is the estimated cost of barriers per council district. In total, it came out to $825 million of costs to address all the barriers that were identified. Again, there's a wide range with that. And you might be thinking, well, you only have $27.5 million. How can you address $825 million worth of barriers? Next slide, please. The way we did that is every single barrier was ran through a benefit analysis, which looked at demand. So the number of schools within a half mile, the students served, so running a network analysis, looking at safety, so the number of bike pedestrian crashes, the functional class score, and engineering judgment, looked at equity, so the number of students on free or reduced lunch, the poverty rate, and then lastly, stakeholder input. So Wikimap comments which were open throughout the whole period, and also public comment. Next slide. The other thing we did was, besides just benefit analysis, we did a cost benefit analysis. And the reason for that was to be able to look through items through two lenses. Just because something would be potentially very high benefit, if it costs $1 million or $2 million due to our limited funding, would rank very low or low for cost benefit. So this is all put into a report, and the report breakdown was a background on Safe Route to School and in how we got to this point, the process that was involved, so talking about the walk audits, the community engagement, an overall benefit and estimated cost benefit chart, which is down below, and then the recommendations by school. So as you can see here, there's a project ID, which ties back to a point on a map, the schools within a half mile, so here there's Graham, the location of the barrier, the issue, the recommendation to resolve that issue, and then next to it, the ranking and overall benefit category, and then the ranking and estimated cost benefit category. So the range is from very high all the way to very low. So we have very high, high, medium, low, and very low. Next slide, please. Our guiding principles were to implement projects that have a high or very high overall benefit, or a higher or very high estimated cost benefit, to make meaningful walking and bicycling improvements near as many schools as possible, and for 2016 mobility bond funding, balance funding equally per district as voted on by the public, and to leverage other available sources of funding to implement additional projects. And this has been great since there was such a large influx of funding to local mobility. We've been able to partner with other divisions, other departments to make sure that our dollars going further and we're addressing as many barriers as possible. Currently, we've addressed over 130 barriers. And in 2020, the city of Austin passed a $460 million mobility bond, which allocated another $20 million to Safe Route to School to help us continue addressing barriers and make it safer for students to walk and bike to school. Unfortunately for us, that $20 million wasn't to be evenly distributed. It was just handed over to us to address the highest need barriers. Next slide. Thank you. We'll now hand this off to Ms. Sarah Bentley.
Thanks, Amir. So next slide. So I'm the research coordinator for the STREETS Study. STREETS stands for Safe Travel Environment Evaluation in Texas Schools. And with the passage of the city's mobility bond funds, we saw an opportunity for evaluating these substantial infrastructure changes. So in 2017, we applied for funding through the NIH, and we received our notice of award in August of 2018. Next slide. So the official title that we're funded under is evaluating the effects of municipal funding of safe routes to school infrastructure on child physical activity, and natural experiment. So what is a natural experiment? A natural experiment is a research design in which individuals are exposed to conditions that are either determined by nature or by factors outside the control of the investigators. They're often done when it would be difficult to do a controlled experiment, as with the City of Austin mobility bond infrastructure improvements. Another example might be national legislation to improve air quality. It's not something that the researcher can control. Natural experiments are often used to evaluate population level environmental and non-health sector interventions and their impact on health. And these types of studies can provide evidence for advocacy and policy making. Next slide. So previous evaluations have shown promising evidence for safe routes to school infrastructure's ability to increase child active commuting to school and child physical activity. Although some issues found in those previous studies were a lack of comparison groups, small sample sizes, incomplete or inadequate program implementation, or non-objective measures of physical activity. Next slide. So with this study, we believe this is a unique and time-sensitive opportunity to conduct a rigorous one-time evaluation of a citywide safe routes to school improvements. We are addressing some of those previous limitations by using comparison schools in other schools outside of the city of Austin in Central Texas. And we're using objective measures, which I'll go into in a little bit, for physical activity. And our rigorous evaluation is both at the individual level and the school level. If this natural experiment is shown to result in changes of physical activity in both individual and population level in a cost-effective manner, this city-driven initiative could be an effective and scalable model for other municipalities. Next slide. So we have three main study aims. The first is those individual level effects on safe routes to school on child physical activity. The second aim is the population level effects on active commuting to school. And the third is a cost effectiveness study, which will use data from both the cohort study and the City of Austin's cost. Next slide. So a little more detail on those. I referred to aim 1 as our cohort. It's technically a quasi-experimental cohort. We recruited 3rd grade students, and we're following them for 3 years through the 5th grade. There will be 4 measurement time points if we get our way in most of those. 3rd, 4th, and then 2 in the 5th grade. And then for aim 2, our population level aims, this is a serial cross-sectional design, and we're measuring these in 3rd, 4th, and 5th grade classrooms once per semester. And as I mentioned, the cost effectiveness will be using data from the cohort and from the City of Austin. Next slide. So this is a figure of our timeline. Since the City of Austin is doing a phased rollout of design and infrastructure changes, construction, we are following their lead there. So they began in City Council Districts 1 and 10. So we also began recruitment and measurements in Districts 1 and 10 in our first year. And then as they rolled out further construction in the remaining City Council districts, we also then the following year recruited and began measuring in schools in year 2 for those districts. As I mentioned, the cross-sectional happens once a semester. As you can imagine, we have had some COVID-related disruptions with cross-sectional data collection being paused for this past academic year due to pandemic-related school closures and generally not wanting to overburden teachers and administrators. We were able to successfully pivot our cohort measures to a contactless data collection this last year, with more than half of our cohort participants taking part in the COVID time point. Next slide. So for that cohort study, we have 44 schools that were recruited into the study, with about 2/3 of those being City of Austin intervention schools and the remaining being comparison schools. We were able to measure participants at 32 of those schools before the pandemic hit last spring. And so those measures include child physical activity measured with accelerometer and GPS. So the participants wear an activity belt that has 2 devices on it, and I'll go into that in a minute. There's a child survey and a parent survey, each of those self-reported, asking about self-efficacy, active commuting to school behaviors, physical activity behaviors, and we do ask the parents some demographic questions. One of my personal favorite parts of this study is the school neighborhood environmental audits. We're using a tool called the MAPS SRTS instrument, which is checklists of assets and deficits in the immediate school environment, including things like sidewalk condition, signage, crosswalks, and other infrastructure and components. In addition, our investigators will be using GIS-based social and built neighborhood environmental variables. So as you can see, we have quite a bit of data to work with here. Next slide. So one of the innovative components of this study is the use of both accelerometers and GPS devices. Combining these data by time matching allows us to objectively see the route to and from school and how much physical activity that their children are getting on the journey. These maps show an aggregate view of travel behavior and where along the route higher intensity physical activity is occurring, with these red dots representing moderate to vigorous physical activity and the blue dots representing very light or sedentary travel, for example, by car. So since we do have those, both the accelerometer and the GPS, we are able to tell by speed how they're traveling. This allows us to identify segments of the routes where active travel is very prevalent. I do want to point out that there's no way that we know which routes belong to individual participants. So this data is completely de-identified. Next slide. For the cross-sectional study, we have 94 schools recruited and participating in this one. So this uses a standard Safe Routes to School student tally. We have these administered by the 3rd, 4th, and 5th grade classroom teachers, where the teacher just asks the kids, raise your hand if you walked to school today, raise your hand if you biked, and then they just do a raw count of the number of students and what their travel mode is. In addition, we have either PE teacher or other administrator or teacher fill out a school health policy survey, which asks questions about programs related to safe routes to school, other physical activity policies or programs, and other health-related policies and programs. And then finally, we collect campus improvement plans from all the schools that are participating and go through those and do a content analysis of those. Next slide. So I'm not done, we have more data. So additional measures include qualitative data. We're doing stakeholder interviews at 2 time points. Last summer, we conducted 7 interviews with City of Austin stakeholders. And just this last week, we completed our parent and child interviews where we're talking with cohort participants. This round, it was mainly focused on how the pandemic has affected physical activity behavior, including beliefs about safety. And we'll do a second round of these interviews in year 5 of the study. And the previously mentioned cost effectiveness study, again, that will have to take place at the end when we have final City of Austin engineering plans and cost data. Next slide. So this is some baseline data from our active commuting to school from the cross-sectional from 2018 and 2019 school year. As you can see, the vast majority of trips are by personal family vehicle. I don't know if you can see that, but it's family vehicle is that darker sort of reddish color in the middle. That was true for both the intervention and comparison groups. The average in the overall study was 14.2% of trips by walking or biking, which is above the national average. The significant differences we found between Austin schools on the right and comparison schools is that the comparison schools have higher percentages of trips by walking and biking at this baseline time point. Next slide. And here's an example of another way we've used our data. We have the potential to use this for many different things. So on this one, this study looked at the association between the number of school policies and practices that promote walking and biking to school and student travel mode. We found that schools that report higher numbers of policies and practices had higher percentages of students who walked or biked to school. We also found that the association of school policy and student active commuting varied significantly by grade, with a stronger effects in 5th grade students as shown in this figure. This highlights the importance of a multi-level approach to increasing active commuting to school, and in addition to the infrastructure changes that the City of Austin is working on, that school policies and practices can be an important component of promoting walking and biking. Just real briefly, I don't have a slide for this, but in another study, we're using streets data. We assess the associations between police reported crime rates and active commuting to school. So that was publicly available data we could get. So we look forward to sharing results and many more in a future webinar or when the studies are published. And next and final slide from me, we just want to acknowledge our funder, as well as our partners at the City of Austin Public Works Department, and as well as our wonderful investigators. I'll pass it back to you, Deanna.
Great, thank you so much, Sarah. And thanks as well to Leanne Ganzer and Amir Imamian for that nice presentation. So now we have several questions in the chat box. So I will be reading them. I think if the panelists could join me, and several of these questions will be directed to different ones of you. So I think the first question is, will you be looking at shade during this study as well? So I think what they're referring to are features around the school that might facilitate or be barriers to walking or cycling.
I can take this one. We will be looking at that. Shade is one of the components of the maps audits that we do around the schools. So we will be able to look at directly around the school how much tree cover, how much, if there's canopies, and so we'll be able to look at the potential associations between shade and active commuting. And actually, one of Dr. Helscher's other studies that she's evaluated safe routes to school programs, the TCOBE study, they did collect these similar types of data. And working with one of our interns last year, we actually looked at this exact association, and especially being in Texas, it's unsurprising that shade on a route to school increases active commuting. So we're looking forward to confirming these using our own data.
Yes, also as part of that study, one of the things that we found is that the perception of it being more attractive around schools, so whether or not the environment was more attractive was associated with greater active commuting, which shows we need not only utilitarian measures of walking to school, but also looking at what the environment's like from a visual perspective. Okay, for streets, do you know the active commute distance for students?
We don't have specific data on that yet. In our cohort study, all of our participants live within 1 mile of the school, or in kind of a 1 mile buffer as the crow flies. So because previous data has shown that that's typically the outer limit for walking. For biking, it can be a little bit further, but there are data, especially from that National Household Travel Survey, that shows that upwards of 50 to 60% of students who live within a quarter to a half a mile walk and bike to school. So there is definitely an association there, but at least for the data that we have at the moment, we don't have those. But compared to previous literature, we're assuming it will fall in line there.
Well, and for our infrastructure report and barriers being addressed, we looked at up to half mile for walking and up to 2 miles for biking.
Great, thank you. So in terms of, could you elaborate more on how you will determine cost effectiveness? I can take a first stab at that, and then Leanne or Amir might want to add to that. But basically what we're looking at is what the city cost of the infrastructure changes are, and then we'll be able to associate it with increases in walking, either in minutes of walking or some of the physical activity measures that we use via accelerometer. So ideally, we'd like to look at what the cost effectiveness is of different types of interventions. Not sure that we'll be able to get that level of analysis done given the types of analysis that we have and the types of data that we will have. So I don't know, Leanne or Amir, if you want to add to that.
I will just say, I think another innovative part of this study is because the City of Austin has been such a great partner for us, we will have access to their very detailed cost data. It's great because they're able to partner with the other departments. I think that we're going to have some great detail in terms of how they're able to stretch their dollars.
Great, thank you. So Amir, this might be one that you want to answer with, and then we can kind of come back in with an answer for. The city's Safe Routes to School program omits charter schools and students. This systematically underserves Hispanic children because charter schools are more Hispanic than average in areas of the city where more charters are located. Will your cost benefit analyses adjust for this and or clearly show the skew?
Yeah, that's something that we've been looking at with this first round. Again, this is the first time we had received funding. So one of our driving factors was catchment area to help mitigate exactly where students were coming from. With charter schools, that was a little bit more difficult. We hope to redo our plan in a few years where we would look to include charter schools. But either way, we are addressing them. A lot of the charter schools are close to other elementary schools or other middle schools, so we're addressing those. And as stated previously, this is the first time we've received funding, but we were still able to get projects done. So we've been working with our sidewalks division, working with the transportation department to address those barriers and those concerns that students that are attending charter schools do have. So we are looking at it, and we're looking to address those barriers.
Great, thanks, Amir. I also want to add there that when we do our analyses, we do have the percentage of children by racial ethnic distribution in the schools. So that's something that we can account for in the analyses. The next question is, you present the commute mode by percentage. Can you translate that into the number of students by mode? Leanne, do you want to take a crack at that?
Yeah, in our baseline, I think we had upwards of, I can't remember the exact, but I know we had, over 16,000 students that were involved in that. It really varies based on the school. We had some schools that there were 0% of the kids who walked, and in other schools it was upwards of 30%. So that's some pretty quick math for me, but we have over 16,000 students kind of accounted for in those baseline data.
Thanks a lot. Amir, did you want to add to that or not? We're just a sample too of all of the schools in Austin, so it's not a representation of all the children who are actively commuting in Austin.
Yeah, and our education team, when they go out to the schools and they take over the PE class for those 3 days, they do ask students how they arrive at school and how they get home on a usual basis. So we also have that data internally, which again helps benefit our engagement team to look at what schools can we work with to get more of those kids walking and biking in.
Thanks, Amir. The next question is, do you have preliminary results on perceptions from kids or parents at schools that have seen infrastructure investments?
We are collecting those data as we speak. We just finished up with our kind of first group of the cohort where we measured both the child and the parents. And at a lot of those schools, infrastructure improvements, some of them have already gone in. So we're hoping to kind of look at that soon, but we won't have the complete data on those perceptions until we get kind of our final cohort. And a lot of those types of data, will also be kind of, confirmed and checked through our qualitative data, where we get kind of a more in-depth discussion with the parents, and sometimes we can get the kids to talk. So we're looking forward to finalizing those.
Yeah, and Sarah, you might want to just touch on the qualitative data since you've been collecting that very recently.
Sure. So yeah, we did a very small sample of our near 500 participants. We talked with 10 parents and 10 children, both in Austin and comparison districts. Since the timing was more of a COVID time point, it was outside of the normal safe routes to school sort of realm, since a lot of kids aren't even in school right now. But I do think that we're gonna get some really great, rich information from that. I do think there were definitely people talking about some of the changes that they've seen since we gathered baseline, and some of them, I think people were like, these are great, and other ones like, we need to do more, which I think kind of mirrors what Amir was saying. We had all these issues that needed to be addressed, but only 27.5 million sounds like a lot, but when you have so much need, it's really not. It really is just a drop in the bucket. But I don't know if Amir, if you might want to say more about the 2020 mobility bond. This might be a good time to drop that in.
And I think the 2020 bond, I think, shows that people are appreciating the improvements that are happening, because this was local mobility focused. It was $460 million. And again, Safe Routes to School got $20 million additional dollars to address the concern. So I think just anecdotally, the community is liking what we're doing. So hopefully we'll continue to be funded and be able to build out more of those improvements.
So Amir, I'd like to kind of follow up on that. I know when you spoke about the data, it's really a lot of improvements that are needed to get us up to what we might say is an optimal level. So could you talk a little bit about why that is? Is it because you have to go back and retrofit, that schools weren't planned at the beginning for walking to school? You know, is it something that just hasn't been paid attention to for a long time? And then, so it would be interesting to understand that a little bit more from your perspective.
You know, honestly, the biggest thing we're finding is that last street. So right in front of the school, just crossing that safely, you know, those little intersections. So what we relied a lot on are, you know, pedestrian islands or bulb outs to make those crossings safer. And then also with, you know, some schools were built for 600 students. They have 1,000 that are going there. There's tons of car traffic. So just those types of changes to the environment, you know, we need to, as the city, respond to them and make infrastructure safer for those that are walking and biking, not just those that are arriving in vehicle. So.
Yeah, I think that illustration that Leanne had on that one slide where it shows the number of people you can get, or the amount of space that it takes for 50 people to be in a car versus bikes versus walking. I think that that's a really good illustration on how much easier it is to move people around and less space and all those other benefits.
Yeah.
Okay, I will take this question. In any of the studies, and I think that meant our data that we presented, were school closures an issue or factor on why less kids were walking and biking to school? And that wasn't the reason in our data, because we collected them when school was still in session. So we have not collected data since schools have closed.
Let me just jump in real quick, because I first thought they were talking about COVID closures, but there's also the issue of the district closing schools, which I can just touch on briefly, because since we're not exactly sure what the question is asking, but because as you mentioned earlier, Deanna, we're only in a subsample of the schools, so we didn't go into schools and collect measures that were either slated for closure or closed. So that should cover both of those options.
Yeah, thanks for following up on that. That is a very important point, Sarah. So Amir, this question is for you. What curriculum is used to educate children? Does it include information on the health benefits? And then how is the child education evaluated?
So the curriculum that we use on campus is created in-house, going off of Teets, our education coordinator is a former teacher. She's a certified teacher. So she's created this content, and there's different games, different activities to make it fun for the kids. There's specific educational tools they use for kids kinder through second, and then different programming for third through fifth. And what they do is make sure that no kid receives the same lesson in their 7 or 8 years in elementary school. So they're learning the same things, but just in different ways as they progress through elementary school. And yes, it does talk about it's just more so in that maybe I should put in.
So Amir, if you don't mind repeating, we had just a little bit of technical difficulty as you were the last few minutes.
Okay, about the curriculum?
Yes, the
The
last
curriculum's, can you hear me?
yes.
Okay. So the curriculum is created in-house by our education coordinator, who's a former teacher, a certified teacher, and she uses the Teets to build that out. What's nice is there's about 8 to 10 different lessons. Some are focused for K through second, the others are third through fifth. So no students receiving the same lesson more than once throughout their whole elementary school education. And they're learning a lot of the same thing, but just in, so, yeah.
Great, thank you. So the last question for this afternoon is AISD is changing their bus policy from 2 miles to 0.4 miles in elementary schools and 1 mile middle and high schools, which among other things should reduce the car congestion around schools. Have y'all worked with them on evaluating the change?
So for my conversation with the transportation department, that 0.4 mile change will only be to specific schools. I don't think that it's a district-wide initiative. I think it's a trial basis currently.
The other thing I should point out is we do have an advisory committee that includes representatives from AISD. So with these changes, we're able to consult with our advisory committee as these happen. So that is something we are concerned about and keeping track of. And so I think that that's it in terms of questions for today. So again, I'd like to thank all the panelists for participating, especially Amir and the partnership with City of Austin. So we really would like to acknowledge their help with this and actually the great work that they've done with Safe Routes to School, which goes back decades actually. So really fantastic work, and we're very happy to have the opportunity to evaluate this. We'd also again like to thank NIH for the opportunity to do this and providing the resources for this. It gives us an added bonus on what we can evaluate in addition to the evaluation that Amir and his team are already doing. So they're evaluating a lot of other parameters about this. So I just wanted to remind you that we will have this recording posted on our website at msdcenter.org. We'd like to thank you all for attending this afternoon. We really appreciate y'all being here. And also like to put in another plug for National Bike to School Day, which is next Wednesday on May 5th. And you can make it your Bow Wow Day. So I really like that City of Austin initiative. One of my favorites. And we look forward to seeing you at the next webinar. So have a great rest of your afternoon. Take care, everyone. Bye-bye.